I want to thank these dignitaries and advocates standing with me here today. I want to thank Congressman Adriano Espaillat for his extraordinary work on supporting our seniors and families. Our New York City Deputy Speaker, Diana Ayala, for her hard work and her advocacy on behalf of New Yorkers. Maria Alvarez, the New York Statewide Senior Action Council Executive Director, and happy birthday. She also came to Washington and testified very effectively to the Aging Committee. Maria Pacheco, who will share her story as well. We are all here to talk about the growing threat to Social Security. It is an urgent crisis, and it's something that demands answers. Over the past few months, the Trump administration and DOJ have announced plans that would make it more difficult for Americans to actually get their Social Security benefits that they have earned, that they worked for their entire lives. DOJ has decided to cripple phone support, even though in-person appointments can only be made by phone. They plan to cut 7,000 staff, even though Social Security Administration staffing is already at a 50-year low. And they plan to shutter at least 47 Social Security office locations, including 2 in our state. The confusion and lack of support staff has made it easier for scammers to take advantage of older Americans who are just looking for answers. The impact of this activity could be catastrophic for seniors and people with disabilities who rely on Social Security to pay their rent, their food, their heating, their medical care, and other essentials. My office is working closely with one disabled New Yorker who was told by the Social Security Administration that she had to call one specific representative and by the end of March, or her application could be denied. She is called every day, several times a day, left messages, and no one has returned her call. Today is March 30th. Those who do manage to get through often have to wait on hold for 4 to 5 hours, and the Social Security website has crashed multiple times in the past several days. I've heard from many New Yorkers who are panicking. Retirees in their 60s and 70s are worried that if they can't get access to their hard-earned money, they might have to return to work or go without essentials like food, heating, and paying their rent. Many have spent their entire careers paying into the Social Security program, and they, like most of us, expect to get their money back. But with fewer staff to process claims, skyrocketing wait times, and a system in disarray, Social Security could effectively deny thousands of eligible beneficiaries the money that they have earned. Imagine what kind of impact this would have all across New York. When people can't buy their food, can't buy their medicine, can't buy essentials, it affects our local businesses, and when they can't afford their health care, it puts a greater burden on our hospitals. Ultimately, cutting individuals off Social Security doesn't just affect them, it affects our businesses, social services, and the entire economy. It affects all of us, grandparents, children, friends, businesses, our community. Across New York, over 4 million people receive Social Security benefits, including 125,000 children. Here in New York City, over 1.5 million people receive monthly Social Security checks totaling over $2.3 billion. As ranking member of the Senate Committee on Aging, I've sent multiple letters to the Trump administration denouncing these actions and demanding answers. I'm asking for detailed information about the Social Security Administration's offices that have had their leases terminated, including the 2 in New York. I'm requesting more information about Social Security's plan to cut over-the-phone services. While the administration has allegedly scaled back its initial plan, the damage is clearly done, and this is creating chaos. SSA phone services are already in disarray, and this chaos and fear among senior citizens and those who don't have internet service or are unable to travel in person is overwhelming. Social Security is our nation's largest anti-poverty program. And here in New York City, we have one of the highest populations of seniors living in poverty. Reducing access to this program is not just cruel, it's an economic catastrophe waiting to happen. Our seniors, our children, our economy deserve much better, and I will keep working to preserve that no matter what. anyone needs help, they can email my office at casework@gillibrand.senate.gov and ask for support from my office. We are here to serve and we are here to help. I'd now like to bring up Congressman Adriano Espaillat to talk about what he's doing in the House.
Thank you, Senator, for your leadership on Social Security. There's 118,000 people in the district that receive Social Security benefits. 17,000 of them are people with disabilities. The rest are retirees. And so this is a major service that is provided for this district, the 13th Congressional District. And the system itself is already strained. Anytime you go to a Social Security office, you will see the line going sometimes around the block very early in the morning. 6 o'clock in the morning, people are already there to get their services. And so this is a really horrible proposal to further strain the system, will break its back. And it will have negative impact on, as I said, over 118,000 people in this district. But in addition to that, they've been trying to close or restrict phone access to the offices. Many seniors and many retirees have mobility issues. They need to make sure that when they go into the Social Security office or they have an issue to resolve, that they have access via the phone. Because of pressure, that has been delayed. But the Senator and I will be working hard to ensure that that does not happen. So to cut services and to cut staffing, it's a horrible, horrible proposal that will put retirees and people with disability in danger. I think it's important that we continue this fight, not just for Social Security, for food stamps. The SNAP program has 300,000 plus people in this district. 100,000 of them are children. And so we got to fight to make sure that Medicaid, Medicare, there's 500,000 people that are Medicare recipients in this district. Just slightly over 100,000 are Medicare recipients. So of the 780,000 people that I represent, over 600,000 of them are either Medicaid and Medicare recipients. So Medicaid, Medicare, food stamps, and Social Security. Those are the programs that we got to fight for. They provide a safety net for our community that allows our families to move forward. Estamos aquí para apoyar el Social Security. Entendemos de que no debe de haber recortes en las oficinas que prestan servicio para nuestros retirados, personas con disabilidades que necesitan ese tipo de ayuda. Quieren restringir acceso a través del teléfono para todas esas personas. La senadora y yo vamos a luchar para asegurar que eso no suceda. También el Medicaid y el Medicare son dos programas que debemos de proteger, ya que hay más de 600,000 personas en este distrito que reciben esos beneficios, y los cupones de alimentos, que también hay un alto número de familias, 300,000 personas, 100,000 de ellos que son niños, que reciben también esos beneficios. De manera que Medicaid, Medicare, los cupones de alimentos y el Social Security son los programas que tenemos que defender para asegurar de que las familias nuestras puedan seguir hacia adelante. Yo le doy la gracia a la senadora Gillibrand por su liderazgo. Yo tengo un proyecto de ley. I also have a piece of legislation that this allows the federal government for taking these monies that the people make when they're in training programs, get added against their Social Security benefits. So we're trying to, their food stamp services, and we're trying to make sure that that doesn't happen. So if you're in a SNAP and you're getting trained to go to work, and you're getting paid for that training, that shouldn't be counted against your benefits. So these are the challenges that we have in Washington, but we wanted to come here to East Harlem and let you know that what we're doing and the kind of help that we need from you. So we thank you both as advocate and the councilwoman as being a long-term advocate here in East Harlem, and we thank her for her leadership. Thank you, Senator.
Thank you. New York City Council Deputy Speaker Diana Ayala.
Thank you. And before I was a council member, I was one of the folks that depended on these social service programs to feed my children and to keep a roof over our head. The fact that members of the administration are saying, hey, you know what, if you don't get your check this month, it'll be fine, you get it next month. It's problematic because I don't think that they take into consideration how communities like these are already in trouble. We have food insecurity that is the highest in the nation in communities of color. The lines of folks that are lining up for food that after the pandemic have not ceased. Those lines go around the block as well. I mean, it's just, I think people underestimate how much we rely on these government, funds. But Social Security specifically is just an insult to injury because that's money that we work for. We're paying into it every single day. Most of these folks, the retirees, my dad who's disabled at home, who depends on his disability check, they work for that money. It is not a handout, it is not charity, it is their money. And I understand we all in government want to try to find efficiencies in the budget and we want to try to be responsible, but you don't do that on the backs of people that need those services the most. And I want to thank you, Senator, and obviously Adriano, who's always been such a huge champion on these issues, because our community members, I worked in senior services for a long time, and I'll tell you that the seniors in this community do not make more than $15,000 a year on retirement benefits. And they need to be subsidized by Social Security, SSI, and SNAP benefits. All of those programs right now are in play, and we need to take this very seriously because this is life and death for most of us. Thank you.
Maria Alvarez, Executive Director, New York Statewide Senior Action Council.
Thank you, Senator Gillibrand, Congressman Espaillat. Thank you, everybody. My name is Maria Alvarez. I'm the Executive Director of New York Statewide Senior Action Council, a 53-year-old organization that has been serving the community through our helplines and assisting people with their benefits and programs. So while we support efforts to identify efficiencies, prevent fraud, and reduce costs, this cannot be at the expense of consumer access to essential services, such as being able to comply with the new requirement that new Social Security applicants and those changing their direct deposits have to go to the Social Security office when some of them are being slated to be cut, as well as short-staffed, so it's hard to get in. We have received reports from our members saying that they have been waiting online on the telephone for 2 to 3 hours, only to either hang up in frustration or be booted off of the lines after they've been waiting for all of this time. One thing that we have to note is that 11,000 people age in every single day at 65 and over in this country. So this issue has to be resolved. The other thing is that in New York State, 90% of the expenses that seniors pay for on their monthly budgets comes from Social Security. So these are vital services and vital programs that need to be part of their everyday life. And then the one last thing that I would like to say is that, ironically, in August 14th is the 90th anniversary of Social Security. And it was passed into law to make sure that women, children, people with disabilities, widows, would not be left destitute. We need to make sure that that commitment is preserved and improved for the next generations to come. Thank you.
Now, Maria Pacheco, beneficiary of Social Security.
Yes, I'm confused with all the changes.
I'm going to ask you to stand here so people can see you.
Okay.
Come this way. Don't stand behind the podium. There you
Okay, very confused. And I live in a senior building, and most of us are on Social Security, all of us, for that matter. And it's very confusing because all the changes that are coming up, they don't understand how they're gonna live if they cut. You're hearing that you might not get your check. If you don't get it now, you'll get it later. Be patient. How can you be patient when you have to pay your rent? You have to buy food, co-payments. Co-payments when you have to go to the doctor. And I appreciate you for the work that you do. Keep it up because we need this stuff. Thank you.
We're happy to answer on-topic questions for